Clinical findings of acute myocardial infarction. The angina is an ischemic heart disease. Acute myocardial infarction is also ischemic heart disease. But if you compare the clinical findings between both, the severity of the pain, the characteristics of the pain, the duration of the pain is totally different when compared to that of angina as well as acute myocardial infarction. So, for example, if we talk about the clinical findings in acute myocardial infarction, especially when we talk about the pain is very severe. The pain is very severe and the pain is sudden onset. Sudden onset. And the nature of the pain is excruciating. Often the patient describes as like crushing retrosternal pain. Crushing retrosternal pain. So this is how we need to describe the pain here. Pain is sudden onset and it is extremely severe and it is crushing in nature, excruciating pain, retrosternal in nature, right? And this particular pain usually lasts greater than 30 minutes. This is very important MCQ. This is how you can say that, like, it is the pain of acute myocardial infarction. Because when we discussed about unstable angina, we said that the minimum duration of the pain is greater than 20 minutes. So whenever the pain duration is greater than 30 minutes, most probably we can say that it is the pain of acute myocardial infarction. Remember that this is not relieved by administration of nitroglycerin. Not relieved by nitrates is another important MCQ point. Pain is greater than 30 minutes of duration. The pain is not relieved by the administration of nitroglycerin. The pain is crushing in nature and it is a retrosternal pain. It is a sudden onset, severe pain. This is what is about the pain of acute myocardial infarction. And this particular pain usually radiates down the inner left arm, sometimes to the right arm also, but is less commonly to the right arm, but more commonly to the left arm, and also to the shoulders or towards the jaw or epigastrium. This is how the radiating pain can be seen with the pain of acute myocardial infarction. It is mainly because of the nerves to the heart are like T1 to T5, and radiation to the inner arm as well as shoulder is the T1 distribution, and radiation to the epigastrium is in the T4 as well as to T5 distribution. That is the reason radiating pain can be seen, which is associated with acute myocardial infarction. So what are the associated manifestations along with pain? So it is not compulsory that associated manifestations are seen in all the cases, but they may be seen approximately in greater than 50% of the individuals. For example, when we talk about associated manifestations, these are the main characteristic features or clinical findings we can say. Along with this, what are the associated manifestations are diaphoresis, sweating, diaphoresis, which means sweating, anxiety, right, anxiety, hypotension, diaphoresis, anxiety, hypotension are the associated findings along with the pain. And whenever we talk about the peak time of acute myocardial infarction, the peak time of day for an acute myocardial infarction is 8 to 11 with a gradual decline from 11 to 6. This is what we need to know about the clinical findings of the acute myocardial infarction. And sometimes we may also see the silent acute myocardial infarction, which means without any clinical findings. So the silent acute myocardial infarction occurs approximately in 20 to 25% of the cases, but these are more likely to be seen in the older adults as well as the individuals with the diabetes mellitus are the one more prone to this silent acute myocardial infarction. Not only that, frequently they have like neuropathies, they cannot feel pain, especially the diabetic people. That is the reason it is more commonly seen in the diabetic individuals, and also more likely in those with a high pain threshold people also, when they cannot feel pain but there will be an acute myocardial infarction. Such patients are considered to be the silent AMI individuals. So this is what is about the clinical findings of acute myocardial infarction.